Good afternoon, I am Dr. Vikas Gupta. Today we will be talking about coil embolization or percutaneous coil embolization procedures for intracranial aneurysms or therapy for brain hemorrhagic stroke. Intracranial aneurysms are one of the very dramatic lesions which usually present when they rupture. Incidental finding of an intracranial aneurysm is really very less. Once they rupture, they cause a very severe headache. A headache which cannot be managed at home, or maybe in a small casualty which cannot be managed. So they need to be managed at a casualty of a hospital. It's a very severe headache which is often described in the literature or by the patient who survived this. It's one of the severest headache of their lives. The cause is usually intracranial aneurysms, and this aneurysm is diagnosed by sectional imaging, that is called CT scan, which shows us the subarachnoid hemorrhage, which is the broad disease of the brain hemorrhage. Subarachnoid hemorrhage means the arteries which lies in the skull but at the base of the brain, the aneurysm is at that artery. And once that aneurysm is basically a ballooning of the artery. There is a balloon on the face of the artery which has ruptured. And once it ruptures, it causes subarachnoid hemorrhage. So to treat subarachnoid hemorrhage, traditionally we have been opening the skull and applying a clip across that ballooning of the artery, which is called an aneurysm. Other way of treating is we puncture in the groin or in the arm, and from that we take our minute devices which are about a meter long, and we close that balloon from inside. The intent is the same, it should not leak again, whether we clip it from outside or we coil it from inside. So coil embolizations is one of the very effective therapies which started somewhere around 91-92. They gained worldwide acceptance in the early 2000s, found by very highly publicized trials. And 20-25 years later, now we have progressed from coils to flow diverters. That is, the concept is heal the artery. So instead of going even inside the aneurysm, we just put in a diverter which diverts the flow away from the aneurysm, resulting in its ultimate healing. Flow diversion as a concept has actually transformed the treatment, if for the want of a stronger word, transformed the treatment of brain aneurysms in last 5-7 years or 10 years in a significant way, which could not have been imagined maybe 20-25 years ago. So numerous people are getting benefited by the use of flow diverters. And the next thing is flow disruptors or intrasaccular devices. They are again one of the very elegant piece of technology which have made life for the surgeon as well as for the patient very simple. Inside the balloon there is something like umbrella which is just left in. Now in retrospect, that intuitively it looks very elegant, that why they were not thought of earlier. But the way they are presenting, it has really transformed the treatment of brain aneurysms. It is just for the social information that brain aneurysms are one of the leading cause of death in cases of brain hemorrhage. There should be awareness about them. Who are at risk? People who are hypertensive, people who are poor control on their hypertension, people who have diabetics, and some renal conditions. For the sake of awareness, people who are hypertension, they should look for regular screening in consultation there with neurologists or physicians. Thank you.